Here we're going to begin to explore the literature on cancer. Cancer is a neoplastic transformation that must be viewed as an environmental process. Cancer is a disease of the genes, but it is not inherited. It's caused by the environmental impact of toxins, malnutrition, and stress that lead to genetic alterations causing errors in replication and transcription. Replication is the process in which the genes reproduce themselves during cell division. Transcription is the process where the genes make new proteins for repair and whatever else they need, including enzymes. When these things change, your cells change. The conditions that are required for this to happen are regions of hypoxia, which is low oxygen, low nutrition, and acidosis, where the body's too acidic. Hypoxia and low nutrition status appear in early stages of carcinogenesis. It causes cells to adapt, that means to change, and they form the later stages of cancer. Cancer has stem cells. Stem cells are original cells that things arise from. They're promoted by inflammation. Chemotherapy has been shown that it not only enriches but also induces cancer stem cells. The conclusion to this is that inherited genetic factors make a minor contribution to the susceptibility to most types of neoplasms. A study done in April of 2010, the President's Cancer Panel delivered a forceful message about the underestimation of the burden of environmentally induced cancers and a lack of testing on many chemicals that are in use. 35% of cancers were attributed to poor diet, 30% to tobacco use, 10% to sunlight, 7% to viruses. Smoking kills up to 1 in every 2 of its users. It's found to contribute to 20% of the rheumatoid arthritis. There are autoimmune antibodies that smoking causes in 22% of rheumatoid arthritis cases, and is found to be a major risk factor in lupus. French fries, one of the favorites of America. Each weekly serving increases the risk for breast cancer by 27% in the preschool diets of the women who were studied. Low-calorie diets, on the other hand, inhibited cell proliferation and induced apoptosis, which is normal cell death in pre-malignant and malignant mammary gland lesions. Vegetables. The quarter of the population that consumes the fewest fruits and vegetables, that's less than 5 portions a day, has about double the incident rate of most types of cancer. Plant chemicals tend to reduce the likelihood of transmission to the next stage in cancers. Estrogen. Hormone replacement therapy increases the risk of breast cancer 1.66 times. DDT is a xenoestrogen. That means an estrogen of a foreign origin has 5 times the increase in breast cancer rates. Estrogen is implicated in 50% of the prostate cancers. Bisphenol A that comes from plastic, it's another xenoestrogen, reduces testosterone, causes rapid milk duct growth. It's implicated in fibroids, uterine thickening, and cystic ovaries. Ethinyl Estradiol, one of the more common forms of hormone replacement therapy, shown to be 100 times the potency of natural estradiol in comparison by weight, both in uterine stimulation and hypothalamic suppression. The hypothalamus is a part of the brain that registers circulating hormones and also has a lot to do with your emotions. Estrogen receptors, there's 2 types. Estrogen receptor alpha has a carcinogenic response. Estrogen receptor beta has potential to treat and perhaps cure disease of the immune system. Soy phytoestrogens tend to be selective for the estrogen receptor beta, enhancing the serotonin levels, decreasing depression, and enhancing senses of well-being. The things that resolve cancer is when the conditions are just right. You need to remove the toxins, increase antioxidants, alkalize the body, oxygenate the body, feed it nutrients, and give it a calorie-depleted diet called a ketogenic diet.